Hello, everyone. My name is Nario Cantu, and thank you for tuning in for the Friendly Pharmacist podcast, starting now. Hello, everyone, and welcome back to the Friendly Pharmacist podcast. I'm Nario Cantu, and today we're diving into a big picture topic that really shows just how powerful and impactful our profession can be: global health and pharmacy. When most people think about pharmacists, they imagine the familiar community setting, counseling patients, dispensing medications, ensuring safety. But if we zoom out and look at the world stage, pharmacists are doing far more. We're talking about roles that influence international health policy, address supply chain challenges, and even help to bridge some of the most pressing health disparities across continents. Let's start with the foundation of global health. At its core, global health is about improving health and achieving equity for all people worldwide. It's recognizing that diseases don't respect borders and that a health crisis in one region can ripple across the globe, as we've seen with pandemics, antimicrobial resistance, or even medication shortages. Pharmacists are at the heart of tackling these issues. First, pharmacists contribute to medication access. Around the world, millions of people still lack reliable access to essential medicines. Pharmacists, through organizations like the World Health Organization, Médecins Sans Frontières, and national pharmacy associations, play a role in building better supply chains, ensuring quality, and fighting counterfeit drugs. Every time a pharmacist helps create a more transparent, efficient medication distribution system, they're saving lives. Second, pharmacists are central to public health initiatives, whether it's vaccination campaigns in low-source MRSA settings, providing antiretroviral therapy for HIV/AIDS, or leading tuberculosis treatment programs. Pharmacists ensure that therapies are not only available, but also used correctly. We've seen time and again that adherence, education, and follow-up are just as important as access itself. And pharmacists are trusted professionals who make that happen. Third, let's talk about emerging global health challenges. Antimicrobial resistance is one of the biggest threats of our time. Pharmacists across the globe are helping to design stewardship programs, educate prescribers and patients, and monitor use to slow down resistance. And in humanitarian crises, wars, natural disasters, refugee movements, pharmacists step into roles that blend logistics, triage, and patient care under extreme pressure. But global health isn't just about crises. It's also about health equity and disparities. In many parts of the world, rural populations, marginalized communities, and underserved patients face higher disease burdens with fewer resources. Pharmacists are creating innovative solutions: mobile pharmacies, telepharmacy programs, and community outreach tailored to local cultures and needs. These models not only extend care, but also empower communities to take charge of their own health. Education and training is another critical piece. Pharmacists in global health are often educators, training local health workers, building capacity in fragile health systems, and sharing best practices across borders. When you train one local pharmacist, you're equipping an entire community with knowledge that multiplies over generations. Finally, pharmacists are increasingly involved in policy and advocacy, from shaping national formularies to advising on international agreements for essential medicines. Our voice is being heard in decision-making rooms that once excluded pharmacy professionals. That matters because policies shape whether medicines reach the people who need them most. So when we talk about pharmacists and global health, we're really talking about a profession that is deeply woven into every layer of the healthcare fabric, from the front line of patient care to the highest levels of international health strategy. And here's the takeaway: pharmacists are more than dispensers of medicine. We are agents of health equity, educators, advocates, and innovators. If we want to solve the biggest health challenges of our time, we need to continue amplifying the pharmacist's role in global health conversations. That's today's reflection on global health and pharmacy. If you're a pharmacist listening right now, know this: your work matters not just in your community, but in the broader mission of global health. The skills you bring, precision, trust, and commitment to safe medicine use, are universal. Thanks for tuning into the Friendly Pharmacist podcast. Until next time, keep serving with compassion, keep advocating for health equity, and remember that every prescription filled is part of a much larger global story.